Hi, my name is Tracy Neely, owner of Charmed Angel Healing. I've created this series of cannabis education videos to aid bud tenders, caregivers, and patients in learning their dose for medicinally using cannabis, as well as the components of the plant that are medicinal. Thank you for watching. This is an image of our endocannabinoid system, or the ECS system. It's found in all animals. The ECS system is known to regulate things like sleep, mood, appetite, memory, and reproduction or fertility. The ECS system uses endocannabinoids and phytocannabinoids to regulate its system to reach homeostasis or full body balance. Our ECS system produces endocannabinoids, which means inside the body. The endocannabinoids that we have found that our body produces are 2-AG and anandamide. Phytocannabinoids come from outside the body, so that would be the cannabinoids that come from the plant, like the THC and the CBD. The phytocannabinoids and the endocannabinoids both do bind to our cannabinoid receptors in the body. We will go over more about those cannabinoid receptors in another lesson. THC is the most known cannabinoid in the plant, and THC mimics anandamide by creating pleasure, killing pain, and eliminating depression. The effects do vary from one person to another, but in general, THC does cause a euphoria effect, relaxation, the feeling of heaviness like the couch lock. It intensifies auditory visual effects, slows your perception of time. You get hungry, a dry mouth, red eyes, short-term memory, dizziness, anxiety, and paranoia, and increased heart rate. People with a disposition to mental illness should be careful when consuming high THC products, as it can cause schizophrenia. For patients with AIDS or those undergoing chemotherapy for cancer, nausea, vomiting, and the resulting weight loss, it can be devastating. And in multiple clinical trials, THC has been shown effective at treating all of those conditions. In fact, pharmaceutical companies created several synthetic drugs back in the 80s that are still used today to treat nausea and vomiting for chemotherapy in AIDS patients. THC is most known for its chronic pain relief. It's used for fibromyalgia, rheumatoid arthritis, neuropathy, severe neck pain, severe back pain. Multiple sclerosis causes the muscles to cramp up and become stiff, which results in aches and intense pain. THC is believed to act on these areas of the brain that affect movement, helps to calm that painful muscle spasm. Many patients find that cannabis is preferred to conventional antispasmodic drugs because they cause side effects to make them feel weak and drowsy. Deep body pain does require layering medication for maximum relief, which we will go over later in another lesson. Recently, studies have shown that cannabinoids like THC are capable of stimulating brain cell production, which means that it's known now to aid with mood disorders like depression. That would explain why it makes us laugh till we cry. Another positive finding is that THC may be neuroprotective, which basically means that it's useful for protecting brain cells from damage due to a lack of oxygen, toxic drugs, or seizures. Apoptosis is when the cells in our body get old and they automatically are pushed out of our body. Well, cancer occurs whenever those cells stop pushing themselves out and they decide to just gather together. Both THC and CBD have been shown in studies to decrease tumor growth and cancer cells from growing. It forces the cells to upsize and push out. So a couple takeaways about THC or high THC for the patient. It can cause high anxiety and increased heart rate. So if the patient has heart issues, they do not want to do high THC. It can cause schizophrenia in people that have mental issues. So keep those things in mind. THCA is the raw THC when the plant's raw. Once it decarboxylates, that THCA then is THC. If you can ingest the THCA, the raw plant, it's non-euphoric. Once it decarboxylates, then you get the psychoactive effect of the plant. THCA is the raw form of the plant before it's been cured or decarboxylated. You decarboxylate the plant by either curing it or by further decarboxylating it in an oven. Patients who use THCA usually are trying to avoid the euphoric effect and the couch-lock type effect from the THC. THCA is known to calm inflammation. It's also neuroprotective, so it's used for Parkinson's and Huntington's disease. It's also been known to aid with nausea and vomiting with cancer patients. So any of those type of patients that don't want the euphoric effect of THC, you can guide them toward the raw plant, or they also have the THC powder now that's a solventless powder that can be ingested. Another thing to note about THCA is when you pair it with CBD, it's a great anticonvulsant for epilepsy. People use fresh cannabis by juicing it. They will steam it and eat the leaves. They'll toss the leaves in with a fresh salad, chop it up and mix it into a salad dressing or a sauce, or use it like a food garnish. Dispensaries do also sell a THC isolate. I've seen diamonds, and I've also seen a powder that can either be ingested or it can be dabbed or vaped. Generally, this product is pretty high in THC, so if vaped or dabbed, it gives the patient a much larger dose for their pain. However, if ingested, it carries no euphoric effect. So my takeaway on THCA, the best way to get the medicinal benefits of THCA is going to be to grow your own. That way you can ensure no pesticides, no bugs, and you can freeze the material for future consumption. THCV is one of the more recently found cannabinoids in the plant. At low amounts, THCV is non-psychoactive, but at higher doses, it'll deliver an immediate and short-lasting high. THCV is most known for its appetite-suppressing qualities. Unlike THC that makes you have the munchies, THCV suppresses that appetite. Scientists found studies on mice that THCV reduced insulin resistance and helped regulate blood sugar levels. So THCV is effective for diabetes patients. It reduces symptoms such as tremors and may delay brain degeneration caused by lesions, making it a great promising treatment for Parkinson's disease. Studies even show that THCV can help with bone formation. Next video, we will go over CBD, CBN, CBG, more of the cannabinoids in the cannabis plant.